All right, today we're tackling a topic that affects millions of people but is still so widely misunderstood: dementia. It's a word we all know, but what does it really mean? Well, in this explainer, we're going to cut through all the noise and get a clear picture of what it is, what it isn't, and how it's handled. Okay, let's dive in.
So here's what we've got lined up. We're going to start with the absolute basics. What is dementia? Then we'll get into the different flavors it comes in. After that, we'll look at the risks and how a diagnosis is actually made, and then jump into management strategies. And to wrap it all up, we're going to clear up a super common and really important point of confusion: dementia versus delirium.
Okay, first things first, let's answer the most fundamental question here. What exactly is dementia? I mean, really nailing this definition is the key to understanding everything else that follows. Here it is, the core idea. Dementia is not just having a senior moment or the kind of forgetfulness that happens as we get older. No, it's a chronic and progressive decline in how the brain works. And this is the absolute kicker. It's severe enough that it gets in the way of someone being able to live their life independently. That's the real dividing line.
Okay, so we've got this term cognitive decline, but what does that actually look like in the real world? What are the things you'd actually see or notice day to day? Let's break down the key features.
You know, everyone immediately thinks of memory loss, and that's definitely a huge part of it, but it's so much bigger than that. We're also talking about problems with judgment, finding the right words, and something called executive function, which is just the brain's ability to plan and get things done. It can even lead to really significant changes in someone's personality.
And here is a point that is absolutely critical to remember. Through all of this, the person is generally awake and aware. Their consciousness is still there. Now that might sound like a small detail, but trust me, it's a massive clue, and it's going to be super important when we talk about telling dementia apart from delirium later on.
So one of the most important things to get is that dementia isn't a single disease. It's really an umbrella term that covers a whole group of different conditions. So let's look at the 4 big ones you're most likely to come across.
First up is the one everyone's heard of: Alzheimer's. It's the most common by far, making up something like 60 to 70% of all cases. It usually creeps up slowly, and memory problems are almost always the first sign. What's happening in the brain is a buildup of these 2 rogue proteins, plaques and tangles, that just gunk up the works and disrupt how brain cells communicate.
Next, we have vascular dementia. And the big difference here is how it progresses. Instead of that slow, steady decline you see in Alzheimer's, this one often happens in steps. So you'll see a sudden drop in ability, then things will be stable for a while, then another drop. It's all because of problems with blood flow to the brain, like from a stroke or a series of mini-strokes.
Now, dementia with Lewy bodies, this one has a very unique signature. A really key feature is that cognition can fluctuate like crazy. Someone can seem perfectly clear one minute and then deeply confused the next. It's also famous for this classic trio of symptoms: really vivid visual hallucinations, movement problems that look a lot like Parkinson's, and a sleep disorder where people literally act out their dreams.
And finally, there's frontotemporal dementia. This one's a bit different because it often hits people at a younger age, sometimes before they're even 65. And what really makes it stand out is that the first signs are usually these dramatic shifts in personality and behavior, like suddenly losing all inhibitions, instead of memory problems. Language issues are also a really big part of the picture.
So we've covered the main types, which brings us to the next obvious questions, right? Who's most at risk, and how do doctors even figure out which one it is or if it's dementia at all? Let's get into the whole assessment process.
Well, the single biggest risk factor is just getting older, but it's not a guarantee. Your genes and family history definitely play a role, but so does your heart health. Things like high blood pressure, diabetes, smoking. All of that matters because what's good for your heart is good for your brain. Healthy blood flow is everything. A history of stroke or a serious head injury also bumps up the risk.
So, making a diagnosis is a really careful step-by-step process. There's no single dementia test. It all starts with a very detailed history from the patient and their family. Then comes the examination, which includes cognitive tests. You might have heard of the MMSE or MoCA. And finally, doctors run investigations like blood tests and brain scans to rule out anything else that could be causing the symptom.
Okay, so a diagnosis has been made. What happens now? The focus immediately pivots to management. And while for most types of dementia there isn't a cure, there is a ton that can be done to manage symptoms and really support the quality of life for everyone involved. The best way to think about management is that it rests on 2 main pillars. The foundation, and always the first thing to try, is all the non-medication support. Then, only when it's needed, that foundation is supported by the second pillar,
medications that help manage specific symptoms. So if we look closer at that first-line approach, it's really all about creating a supportive and predictable world. That means things like activities to keep the mind engaged, changing the home environment to make it safer, setting up simple routines to reduce confusion, and, this is a huge one, making sure caregivers get the education and support they need.
Now, when we look at the medication side, there are a couple of main classes of drugs. You've got cholinesterase inhibitors, like donepezil, which can help boost the brain chemicals involved in memory. For the more moderate to severe stages, there's a drug called memantine that works a bit differently. And other medications might be used, but always very carefully, to help with some of the more challenging behaviors.
Okay, on to our final section. And honestly, this one is so important. Being able to tell the difference between dementia and another condition that can look a lot like it at first, delirium, is absolutely vital for anyone working in healthcare or even for families.
This table just lays it out so clearly. Let's look at the onset. Dementia is slow and gradual. Delirium hits you like a ton of bricks, it's sudden. The course, dementia is a steady downhill slide. Delirium goes up and down, sometimes hour by hour. But here it is, the most important difference, the one we talked about earlier, consciousness. In dementia, the person is aware. In delirium, that awareness is clouded or impaired. If you remember one thing, remember that.
And that brings us to the future. With all the amazing research happening, new blood tests for early detection, therapies that actually target the root causes of the disease, the way we think about, prevent, and manage dementia is changing fast. It's a field with enormous challenges for sure, but also one filled with a growing amount of hope. Thanks so much for joining me for this explainer.